making a very, very important contribution. And I know the honorable members who are debating this bill do not have anything to do with the Dr. Pukose as a person. And so this is a professional issue.
Okay, the Honorable Hagushi, I'll have my eyes on the health committee chair. I'll have
Thank you, Honorable Speaker.
And ensure that he does the right thing. The Honorable Soro, go on with you.
Thank you, Honorable Speaker. Honorable Speaker, I wanted to clarify just a point that has been raised by Honorable Ngong about who is also a lawyer like myself, and he happened actually to be my classmate. But let me say this, Honorable Speaker. I am talking about some rogue doctors who take, Honorable Speaker, protect me from Honorable because I do not know why.
Honorable Soro, you shall proceed with your debate, regardless of what the chair of Committee of Health does.
But he's shouting at me, Honorable Speaker, as I speak. I'm saying, in every profession, we all must agree that you've got rogue people. And really, we have rogue lawyers, we've got rogue police officers, we've got rogue politicians, some of them, of course, carrying stones and sufurias in the head. We've got rogue people in every particular profession. And it shouldn't be, Honorable Pukose should not take really offense when I say there are some doctors who are rogue. I mean, really. And Honorable Ngong should also not impute improper motive on my person that I charge legal fee of 500,000 for consultation. That is a lie, Honorable Speaker. He knows as a lawyer that there is a remuneration order that we follow as advocates. And really, I have never charged 500,000 shillings as consultation fee. And really, that is wrong. I mean, really, you need to apologize. I have never, because I have clients watching me and they imagine that tomorrow when they come to my office, I'll be asking them 500,000. I'm not a rogue lawyer. But let me say this, Honorable Speaker, that some doctors
will be known that we are discussing a bill relating to healthcare. It shall be known that way. We are not discussing lawyers' fee.
Exactly.
And I directly proceed with your contribution the way it was going on before the interruptions.
Very true, very true. My contribution was that those people who take advantage of the poor with this particular act, Honorable Speaker, this particular amendment will actually save face to this nation. It will be able to bar the rogue doctors who take advantage of patients, ignorant patients, and it will help strengthen the laid down policies, especially if they are placed from the regulations and placed in the act, so that we're able to streamline the health sector of our country. Thank you, Honorable Speaker.
This chance goes to the member for Mandera South. Member for Mandera South. He's the first on the list here.
Thank you, Mr. Speaker, sir.
And members, I will not encourage members carrying their hands up. I have a list here, I have a board here that I'll follow. So don't carry your hands up, don't come to me. Let's just follow what is here so that everyone gets a chance to contribute. Go ahead, member for Mandera South.
Thank you. Thank you, Mr. Speaker, sir. I stand to support the bill proposed, the amendment bill proposed by Honorable Didmas Baraza. I think it is a good amendment. If there were regulations which were existing before, like it has been argued in this House, I think sensitization about those regulations and how they operate have not been known to many Kenyans, especially those Kenyans in the rural areas. And I think an amendment to introduce an amendment like the one proposed by Honorable Didmas Baraza to introduce a clause or a section that will require the Cabinet Secretary for Health to enact, or rather to come up with a regulation for referrals both internally and outside the country is a very welcome thing, because healthcare has been a very expensive venture for many Kenyans. And we always say Kenyans are just one hospital admission away from poverty. And we know these issues of referrals have been abused in the past. And I think this is this amendment, according to me, is not an amendment that comes to reinvent the wheel, but it is an amendment that will help us reflect on what already exists, because there is reference to the idea of bringing together all the stakeholders to discuss on how efficient and how effective these referrals can be made both inside the country and outside the country. So this is an opportunity for us to reflect on what has been existing and see how we can cure the problems that we've been having with the existing regulations, if they exist. And therefore, I think it's not a good idea for this amendment bill to be killed at this stage by the recommendation given by the Health Departmental Committee. I think this bill should go ahead, and Honorable Didmas Baraza should be given the opportunity to execute this bill to the fullest, and I stand to support that. Thank you.
Thank you. Member for Western Gishu.
Thank you, Honorable Speaker, for the opportunity for me to be able to lend my voice to this particular debate. Actually, this is the most interesting debate I've had since I came to Parliament. This is really what we are supposed to be doing. Even though we don't agree with each other, the fact that we are interrogating laws that will affect Kenyans is what we are hired by the Kenyan people to do. My reading of Section 79 is that it already provides for referrals. Not in great detail, but loosely. And that is not a bad thing. Over-regulation is the danger that we are going to face should this amendment brought in be approved by this House. When you over-regulate, then you run into the danger of some bureaucratic process getting involved in critical life and death or health decisions of individuals. Already, we have the Ministry of Health historically has even problems of transferring medicines from the central government down to the county levels or the village dispensaries. Now you're giving them an extra task, an extra bureaucracy, that they will now make rules and decide how you decide to seek medical attention. I can tell you, if you allow those regulations to be made, what's going to happen is several people will die while they are seeking for medical help. Just getting someone to see a doctor in a public hospital, or even to get to a theater in a public hospital, is a nightmare already. Now you're telling me they will be deciding who travels to whichever country to seek medical attention. They are not capable or do not have the bureaucratic machinery to do that to that detail. I would hate to think that today people go and seek for treatment overseas. Why? We lack the technology or the know-how or cheaply available treatments in the country. That's why people seek medical attention abroad. The decision on what kind of medical attention I would like to have is between me and my doctor. And if my doctor does something wrong, there is a medical practitioners board that can discipline that individual doctor. We do not need the ministry managing them. And if, as proposed by Honorable Didmas Baraza, there is a need to rein in rogue doctors who are referring people unnecessarily, that can be dealt with by the Doctors Medical Practitioner and Medical Practitioners Board. It doesn't have to, because that's a problem of an individual doctor. It is not a national problem. We cannot get national policy solutions for individual and professional individuals. That is the wrong way to go. Then in that case, we will now begin to say that okay, you can have your point.
Informed by the Honorable Soro?
No, I doubt there is anything he can inform me. I was actually his law teacher, so I doubt that he can have any superior knowledge that whatever he knows, I taught him. Whatever he doesn't know, I plan to teach him. So we'll continue with the lesson. Yes, so that is the challenge. Yes, there is challenges of rogue doctors. There is challenges of unnecessary referrals, we agree. But trying to get another bureaucratic machinery to regulate it is even getting us into even deeper problems, because they do not have the capacity. You can't tell me they'll start supervising which doctors 50 million Kenyans go to when they can't even give them access to medical care as we speak today. Let us not put more burden on that ministry. And for that reason, I support the decision by the committee. Thank you.
Said, Member for Funyula.
Honorable Speaker, thank you for giving me an opportunity to comment on the Health Amendment Bill number 20 of 2022. Honorable Speaker, the cardinal role of a legislator is to pass laws. So from a policy point of view, from a practice point of view, we should allow any legislative proposal, as so far as it's constitutional, does not in any way infringe on the current legislation, is within public policy, and is a well-researched and thought-out legislative proposal to go the long way to the far end. So in this regard, Honorable Speaker, on the other side, Honorable Speaker, we are at a dilemma as Kenyans and as people, the fear of overregulation. Honorable Speaker, looking at the provisions in which our honorable colleague intends to amend, that's Section 79A, brings to fore into a very subtle debate that seems to have not been settled in this country and probably elsewhere. What comes first? Is it policy, framework? Is it legislation or subsidiary regulations? Honorable Speaker, I would imagine that within the infrastructure, the fraternity of the medical field, there are very clear policy regulations concerning treatment, referral, all those kind of process up to the far end. Secondly, Honorable Speaker, I do believe and trust that the medical profession has got practicing notes that clearly state when the matter is to be referred, what's the process of referral, and what is the rest of the things. As far as we allow our medical doctors to be registered, to be thoroughly and adequately trained, probably for a longer period than most professions in this country, 5-6 years or so, for them to go through internship, to go through clinicals, up to the time they are registered and given authority to practice. We must have some kind of confidence, some kind of trust in the process. If we don't trust the process that leads to registration and certification of our doctors, then that's where we need to train our eyes on, resolve the matter. Honorable Speaker, I would be very afraid that I go to hospital, my heart has stopped pumping for one reason or another. Probably the poll results have not been good, or probably something has happened, and my heart stops pumping. And I'm in Seaport Health Center, which has no facility. For me to be referred to BCI referral, a county referral hospital, there must be another bureaucracy to approve. Honorable Speaker, yes, it is normally very good, politically good, to bring on the House some legislative proposals that gives us a political platform gives us airtime. But let's look at things from a practical point of view. You are calling a bureaucracy, and here they are saying the body responsible for registration and licensing of medical practitioners and dentists. The gentleman in charge has traveled to Siberia. The gentleman in charge is asleep. The gentleman that's in charge has taken one too much for the road. Is unable to make rational decisions. What happens, Honorable Speaker? We need to be very, very careful. In any case, we are going to a regime where we need to have less regulations and allow the professionals take professional decisions, and they are taken accountable, they're held accountable. All these doctors, Honorable Speaker, are registered by the professional bodies. So they have a duty of care to the patients, the stakeholders, so-called stakeholders. I don't know where stakeholders get involved in my personal medical problem. Secondly, Honorable Speaker, even the most telling, Part B of 2B, talks about National Hospital Insurance Fund. Does this now therefore mean those who are not members of the NHIF and are going to fund for their own medical bills, they have separate medical cover, medical scheme? What happens to them? When you are legislating, Honorable Speaker, there is a principle that you must legislate for the entire people who are the entire country, not only seek a subset of a particular people. Honorable Speaker, naturally, the minister or the CEC in charge of health would pass regulations, policy statements, and consultation in pursuant to Section 79. Adding Section 79A, Honorable Speaker, is just superfluous, adding layers of bureaucracy upon existing layers of bureaucracy. I know Honorable colleague had very good intentions, but this is a matter he did not have a deeper thought. Probably who assisted him to develop the legislative proposal and even the bill never mentioned to him the existing technical framework in this area. But as we say, it is the members of this House who have got the final say on this bill. You let it face its fate in the third reading, so I mean in the committee of the whole House, plus the third reading, so that members can apply their knowledge and their proposals into it. As much as I'll be very reluctant to put down a colleague who has brought a legislative proposal, because at the end of the day, his constituents, the members of public, will judge him to as many bills as proposed and passed through. I therefore request, Honorable Speaker, I, as a member of Funyula constituency and as a Kenyan who has been involved in policy formulations, policy review, I'll be reluctant to support the bill as drafted, because generally, Honorable Speaker, it is usurping the administrative function of the medics.
Honorable Wondo, there's a request by the member for Wasingishu to inform you. Do you want to be informed by her?
With due respect, yes, for her, I will allow her to inform me, probably on matters of law and the rest of the issue. If it isn't, then I will respectfully decline to be informed. But being however, she was my chair, and she's a deputy speaker, allow her to inform me.
Yeah, you have to inform her, inform him in a minute, because you contributed already. Just information.
Yes, thank you, Honorable Speaker. I think the point of information here is that Parliament does not legislate in futility. Should even this amendment be approved, the problem is what people will do is simply fly to India as a visitor and then go and seek medical treatment. Then the whole process of referral will fall apart. So it is not capable of implementation. So on that reason alone, then it is not something that we should even be looking into. Thank you, Honorable.
There for you, Honorable Wondo. I think you're winding up.
Thank you for information. Honorable Speaker, I'm just being polite and sympathetic to the promoter of the bill. Obviously, being a young man, where we come from in our community, you don't put down a young man with harsh words. You allow him to ventilate and talk his heart out. Then we, the elders, sit down and say, young man was spoken very well, but this might work or might not work. You need to modify it in one way or another. I would suggest, Honorable Speaker, the honorable member, through probably the Health Committee of Health, probably impresses upon the minister to have, and probably the medical body, to clarify on the practicing notes of the medical fraternity on the best way to actualize this process, instead of bringing another unnecessary layer of bureaucracy. For this, on this account, Honorable Speaker, I'm at pain, but probably allow me to make a reservation about the workability of the process that's being proposed here, and probably request the promoter of the bill to relook at it now that he has heard our members speak, has heard the committee which received the report from the experts. Let him consider those issues as he rethinks through, so that, as the Honorable Deputy Speaker said, we don't legislate in futility. We don't legislate things that cannot be implemented. In this country, we have a problem. We pass very many laws that even the implementation becomes difficult. They just hang around. Honorable Speaker, you are aware there is a bill concerning NGOs that we passed sometimes in 2013, which has never been operationalized because it's impossible to operationalize. You remember we had regulations about askari rungu, I mean these guards, which we cannot operationalize because it's practically impossible to operationalize. Let not Parliament become a body that legislates in futility. With these few remarks, Honorable Speaker, I beseech the young man, the Honorable Member of Parliament, who is still young and with the hot blood running in his veins, to relook at it, so that as members of Parliament, being the elders, we can relook at it and fashion it properly. A sincere thank the contribution by Sir George, which was in good defense of the promoter. But you know, Sir George, you have metaphors so much. When you were in the last Parliament, you are a very sober and objective man. But over time, no power, absolute power, makes somebody forget where they have come from. But this happens even Saul, on his way to Damascus, he changed tremendously. Thank you, Honorable Speaker, for those few remarks. Allow me to have my reservations and ask that we proceed, but basically just note for the wonderful contribution and say thank us God to the records, but let us not pass the bill as it is. Thank you, Honorable Speaker.
The member for Dagoretti South.
Thank you, Mr. Speaker. Dagoretti North. First, Mr. Speaker, as I appreciate the bill, I just want to proceed on the same lane just the last speaker has gone through, and to appreciate that, yes, there is need for us to really look at the many issues that are affecting Kenyans within the medical field. Especially, Mr. Speaker, when we talk of health, it's a very personal issue. It is one thing that Kenyans have gone through a lot of challenges, Mr. Speaker, ending up even in poverty. And Mr. Speaker, if we really want to enrich within this amendment, then we need to really restructure it and see a better way of looking at how Kenyans are suffering and how we deal with referrals, not just by going abroad. I think the most sad part is the referrals within the country. That when you're coming from a place like, let's say, for example, you are in Gatina dispensary and you need to be in, for example, Mbagathi or Kenyatta National Hospital, that referral itself is the most fortunate that when you arrive, it depends on, at the arrival, if you get a good nurse who will understand, then they will put you through. If you don't, so in our amendment, what we should be talking is not how even the referrals are done by doctors. It is whether from a dispensary, indeed they've referred me and I'm allowed to arrive at Kenyatta National Hospital and be given be treated, or even just being admitted in that hospital after I have been referred. And so, Mr. Speaker, even as we speak about, one thing I would not want us to really, and I will beg even the promoter of the bill, is that when you give now the Ministry of Health to be the ones to decide how people will travel even out of the country, you will have finished Kenyans, because even us here, you as a member of parliament, many of your people have traveled, you just hear them, they've already arrived, because it's a very personal thing. Families contribute. What we should be talking about is how we look at even just the cost. It has become so expensive. I saw my colleagues, we were arguing and we were laughing, but you see, when a Kenyan looks at us, that we are laughing at the fee, Speaker, that we charge Kenyans on treatment. In fact, what they should be trying to help us is there a day we shall talk of prevention? Because it's like, Mr. Speaker, we've opened up, it is okay, and we must have very interesting hospitals all over, but nobody even comes in this house, even as we speak at that referral, to ask ourselves, is there a time we shall have also a mechanism of prevention before we have now Kenyans just becoming sick? It is like everywhere you move, Mr. Speaker. There's a hospital in Westlands, Jalaram. I mean, it is the modest. And when you walk in, you'll find all walks of Kenyans, Indians, I mean Asians, everyone. But they will charge you at a reasonable price that you will be wondering what is happening on this other side where our Kenyans are going. I know many of them don't know. It's a hospital that has been there for roughly 3 or 4 years, but it's an outpatient hospital. But let me tell you, the charges they'll give you in terms of your imagings, and when you go for all the things, MRIs, you will be surprised and ask yourself, so what is the difference? The other day I went to a hospital, I won't say, it's a high end, and they have this new MRI. Mr. Speaker, they tell you it will give you music, it will done, but then I ask myself, I wish in that hospital we'll be having a very different way of doing these things that we are using, because we have gone so much in equipment, in imaging. We've made health to become like, it is now the highest way of just making profit. Yet it is a social need. Nobody would love to be in a hospital. And so when we are talking of referrals, while I appreciate my leader, my senior, Honorable Didymus, I will tell you, it will be misused. We will now, Kenyans will start begging. They will do a line at the ministry, you'll wonder. Because everyone, and anyway, doctors also will take advantage of the same way they've taken advantage of Kenyans that go to this clinic, go to this place for imaging, and this is the same way. But more importantly, I want us to deal with referral, first of all, to make it easier that a Kenyan can leave from Kawangware and enter Kenyatta Hospital. If she or he has a referral letter, then Kenyatta Hospital should welcome and take good care of that patient. Mr. Speaker, even in accidentals, you see, when you're caught on the road in terms of an accident, you are in an emergency, you will find yourself sitting, lying on a bed since the time you arrived at the emergency door, because everyone is asking, okay, how many places have she passed? And they're not telling you, so the doctors will just pass you there, and time is going, and that is how many patients in Kenya. In fact, many of our people in this country have passed on, not because they were supposed to pass on, just because of some, sorry to use this word, and I know I respect doctors, sometimes carelessness, sometimes ignorance. I will tell you, I took care of a baby, Mr. Speaker, roughly 6 months, took the child to Medhill Hospital, was treated very well, returned home. This young infant developed an intestine problem, which is very normal to kids. But I won't say now the hospital. went there, took like 6 hours, Mr. Speaker. By the time in the evening, they are saying the doctor there is unable, so move to Kenyatta. By the time they were arriving in Kenyatta, the baby is gone. Something that was so simple, a referral that was just, and those are some of the challenges. So as much as we will say we will not want to look at the mechanisms of referrals, I would urge the promoter of the bill, go and do more research. You will find that the referrals within our own, and it should not be under the ministry. It should be a referral where that small clinic, that small level 4, level 5 is allowed to push you to level 6, and when you arrive, they must appreciate the letter you have walked in with and be able to be treated like any other Kenyan. For national insurance, Mr. Speaker, it is time we also try and push that these chronic diseases, Mr. Speaker, we have our, I'll say our women, our men, our children, our orphans, most of them who go through different treatments of chronic diseases. We need now NHIF to take care of that. And we have to really request the government to look at it. There is no need of pushing some of these things, yet we can't help. We have to also relook at even how we treat, and national insurance must also come in, even those who are going out of the country. I know it supports, but all the time we have to go back, Mr. Speaker, and request for them to check, request for them if this can be paid. Some of those things you find that you have lost a patient, Mr. Speaker. So I will request that we relook more before we bring back this in the House. Let us look at the best way and the sufferings Kenyans have had on referrals within our country mostly. And with those few remarks, Mr. Speaker, I wish to tell the promoter, let us look at it and do more research before we bring it back to the House. Thank you.
Member for Kipipiri.
Thank you, Honorable Speaker, for giving me the opportunity to say something on this bill, which, Honorable Speaker, when you listen to all of us who are speaking, somehow one may get lost. Honorable Speaker, any bill, any motion, or any indication of any legislation, when it is being drafted, the drafter must be having some ideas to table. And as such, I want to believe the drafter of this amendment obviously had good intention. And what we should do is to look at this amendment in depth, other than condemning it, and we find what is that good intention that they move ahead and build on it. Honorable Speaker, first, we have raw professionals in all cadre, be it in legal, be it in the churches. We just recently had the Shakahola haulers, be it a politician or every other avenue. And I think, or I feel, this is the sole reason why the mover of this bill was making this amendment, to try to regulate, because time and again we have seen, particularly doctors who own hospitals, who own pharmacies, do refer patients to their premises or their hospitals. And Honorable Speaker, when I look at this amendment and I read the Article 79, there are two different issues. First, the Article 79, which is being amended, it is speaking of the National Government Department of Health shall develop policy guidelines for referral mechanism, a system of referral for practitioners of, let's underline there, of traditional and alternative medicine. So, Honorable Speaker, when members say that this is already catered for, this regulation is already there, I oppose very strongly. Because this Article 79 is clearly saying the National Government Department of Health shall do these guidelines to practitioners off the traditional. So it is not provided for the practitioners on medical health. That is one. Two, Honorable Speaker, when we look at referrals, and I happen to have been a victim in one way or another, and Honorable Speaker, I wouldn't mind to say this on this floor, that one time I was expectant and I visited my gyno, and because he was having his business privately and I was seeing him privately, and he was the head of Kiambu District Hospital by then, which is one of the biggest referral today in Kiambu, he referred me under his care to Kiambu because I had a good insurance package. And when he took me to theater, the following morning he told me, I'm sorry, this scan was not clear as we had expected. So we are just sorry. That time I had already gone through the theater. So I want us to take this matter very seriously, Honorable Speaker, as honorable members who are here to protect the vulnerable Wanjikos, the vulnerable Ochieng, the vulnerable people in Kenya who cannot come to this house and seek or guide the government on how they should be taken care of. Maybe when we think of referrals, we are missing the point when we say that we are going to bring bureaucracy. I do not think that is the intention at all. I think here we are first tasking the cabinet secretary, because the original Article 79 is speaking of national government, the Department of Health. That to me is vague. When we speak of cabinet secretary, he is solely responsible. Again, we are missing the point, Honorable Speaker, when we say we create bureaucracy when someone is dying and we need authority. I don't think that this amendment is speaking of authority to be given. I think it wants to regulate how referrals will be done. For instance, Honorable Speaker, even if we are not debating on the cost, but we cannot avoid, if a patient in Orkarao who could have been referred to JM Hospital in Orkarao is referred maybe to MP Shah, where consultation fee is so huge, and the background of this patient cannot even go to half of what the patient can afford. I think these are the regulations that the drafter means. And again, if the cabinet secretary will make these guidelines must come to the house. When they come to this house again, we shall redefine them, and we shall amend, we shall edit at the committee stage, and we shall make them what we want them to be. Honorable Speaker, on another event, I happened to be in India, and I found Kenyans being stranded because they were being referred to India for medical, and the invoices that were given while they were in Kenya, the cost was not going beyond 200,000. And the Kenyans were stranded there with bills of close to 6 million Kenya shillings, and the ambassador there in India was moving every morning to have a meeting with the management of the hospital to release our people. So I do not see any problem when this regulation can be even tasking our embassies outside to be even taking care of the patient who plan to travel for medical overseas. I think any regulation is free at will, and I don't think that if I can afford to go to India or abroad for medical, then I must pass to the embassy if I do not want. But overall, it should be indicated in black and white that it is the mandate of the embassy to take care of those who seek information. So over and above, Honorable Speaker, I would say we don't kill this amendment here. We analyze it, we enrich it only for the benefit of Wanjiko. With that, I oppose the report of the committee, and I support this amendment, and I hope the honorable members will be able to make even more fundamental amendments during the third reading. Thank you, Honorable Speaker.
Member for Nyeri Town.
Thank you, Mr. Speaker. Mr. Speaker, I'm a member of the Health Committee. And while I congratulate my senior, Honorable Didmas, on the thought behind this amendment motion, I want to highlight two things. Number one, the introduction of the NHIF into decision-making in the referral system is not desirable. Today, NHIF, after collecting money from Kenyans, then goes ahead and accredits health facilities where the members seek services. You go to the same health facility that is accredited by NHIF and that you are designated to obtain your primary health services. And you find in that facility, the only guarantee you have is a prescription. Either to go to a pharmacy, go to a medical lab, or go to an imaging center. And when you get there, you don't get the medicines, you don't get the lab tests, you don't get the x-rays. If NHIF cannot be able to assure about the quality of services in institutions that are in this country, what capacity does it have outside our country? So already we are giving a weak institution a responsibility over a service that a delay of a single day could have life-changing effects. At the same time, we have to sympathize with the Kenyans who, after entering the clinic of a medical service provider, are literally held captive there until the disease has progressed to the point of causing lifelong disabilities and effects on their health, permanent effects on their health, before they are released and referred to higher level facilities or personnel of service provision. And that, to me, is where this bill should be taking us. The organization of our health systems should come into focus, because we start from a level 1 who is a community health volunteer who is not even on pay, to level 2, which is a dispensary most likely managed or run by an enrolled community health nurse. Then to a health center where we'll be lucky to find a clinical officer who has a higher national diploma. Then to the level 4, which was supposed to be a sub-district hospital, where we will have an MO. Then to the level 5, where we are supposed to find a registrar. And therefore you find that in that continuum, in every facility there is a delay, there is a time lag, whereas the disease is progressing, the damage continues to get done. If that is where we are going, then we need to look at exactly where to vest that power. The internal referrals within our country and the referrals outside the country. If this bill was asking the Ministry of Health to liaise with our missions abroad so that we can have the specialist hospitals available at the click of a button for my mother in the village in case she needs a referral, then I would be supporting this bill. However, today, the introduction of another desk at the Ministry of Health, which we all know we refer to as Mafia House, we are just adding, putting our people in the hands of the mafia at Mafia House. These people ran our country down in the face of our people dying from COVID. It is therefore.
Member for Naivasha, what's out of order?
Is Honorable Madenge in order to call Afia House Mafia House? What does he exactly mean?
Honorable Madenge, go and explain to the member for Naivasha what Mafia House means.
Thank you, Mr. Speaker. I was an employee as a very young man, having graduated from the Kenya Medical Training Center. At the age of 20 years, I was an employee of the Ministry of Health. I had a personal number at the Ministry of Health. This ministry, for me to get my first salary, I had to bribe somebody, or I would wait for more than a year. For me to get I left public service without being promoted, despite serving for 5 years, while I was supposed to have been automatically promoted after 3 years. The stories of what happens at Afya House, and that is why the health sector employees refer to Afya House as Mafia House. Mr. Speaker,
now you know.
NHIF today is paying a provider for rescue services, ambulance services, based on the total number of subscribers, membership of NHIF, instead of the number who have benefited from this service. It therefore means where there is need to sort out our referral system, this bill does not go far enough in sorting the real issues. However, it is an issue that as legislators we have to grapple with. So, Mr. Speaker, as a member of the Health Committee, I start by the decision of our committee to oppose this bill in its present format. Thank you, Mr. Speaker.
Thank you, Member for Achuanyo. Mr. Achuanyo.
Thank you, Mr. Speaker, for giving me an opportunity to air my views on this topic. Mr. Speaker, the first question that we must ask ourselves is why people get referred. Reasons are many. The first compelling reason is the kind of problem, the kind of disease the patient is going through. It must be a serious one that's beyond the referring doctor capacity to treat. He acknowledges that he can't do it, either because he lacks the equipment required, the machines required, or even the medicines themselves that are needed to treat this patient. That being the case, surely, if we are going to subject this patient to some bureaucracies before transfer, we will be adding problems to his suffering from the illness. I feel it is very important that if somebody needs to lengthen his life through treatment because he's sick, that person should be given an opportunity, and his doctor should be given an opportunity to take action as soon as possible. I've never heard of a case where somebody passed on because he was referred. But I know of cases where some people leave this world because they were not given proper medical attention because the treating institution didn't have the capacity. Reasons are there for transfer. Unless this amendment is going to improve the treatment on the patient in terms of the quality and in terms of the time, Mr. Speaker, I won't support this bill. But if it can prove that the patient is going to benefit from this amendment, I would say it is okay. From what it looks like, we are trying to inject some political consideration in the existing bill before amendment in order that we can really control how things are happening. If a patient is sick and is to be taken to India. Then you want to go through all the bureaucracies which may be on the way. We will be adding to the problems of this patient, and he might even say kwaheri to us when the death would have been prevented. Mr. Speaker, we all know what happens even locally. Some patients have died because of no quick action, and he dies before he even sees a doctor. There are cases when treatment is required like yesterday. Action is required urgently. I am aware that referrals have been done just because you know where the patient is not getting a good treatment. You as the relative of the person, you know it, that particular place is not good enough. Now, if you feel concerned that this patient must be taken to an hospital where treatment can be better, surely bureaucracy should not come on your way. Mr. Speaker, this is a bill that is dealing with human life. We should treat it as a bill dealing with human life. And anything dealing with human life must be given the best consideration and the quickest consideration. We must know that a patient needs action and timely action, plus medicine and relevant kind of medicine. Treatment that can be quick and positive against the progress of the disease the patient is suffering from. If this bill can support what I'm saying, and it can support the patient and get him treatment quickly, including the patients who may need overseas treatment, if it can support that fully and give a timely action, then I would be able to support the bill. But I can see it that as we add steps to be taken before you send a patient to the place he needs for quick action, since this bill is going to be creating some steps which I don't think, administrative steps are not necessary for a patient who is in his deathbed. With these concerns, Mr. Speaker, I do say I'm uncomfortable with the bill. Thank you.
Member for Narok North.
Thank you, Mr. Speaker, for giving me this opportunity to add my voice to this amendment bill by Honorable Didimas Barasa. As I was sitting here, I was listening to professionals talking about health, and others even included law, which I think is not the issue. To me, the issue here is the common person that we represent in this house. And I listened to the chair, the health chair, and he said that we have a bill in place. And I don't think it is proper for us to put another bill on top of another one. But if we were told to look at the existing bill and see what is lacking so that we can put more of our needs in that bill, it would have been better for us. Yes, the problems are there. And as the speakers were speaking, our people down there are undergoing so many problems in terms of getting proper treatment and referrals to the hospitals, because the doctors, you say, refer people to where they have clinics. And even when you go to the doctor, he tells you where to buy medicine from, a chemist that will go. He even goes to an extent of telling you, if you will not rush there, by tomorrow, that medicine will not be there. How do they get to know that the medicine is only in that place? Then I want to say that what is there is a problem that we need to look at and see what is happening in that sector. Because our people are not getting proper medication and our people are not really getting treatment at the right time when they need it. So to me, I think the policy that is already there is enough. What we need to do is just to ask the mover to go and relook again into what the amendments he wants to make so that we can strengthen what is there. And the strength we need here is on the treatment and the medicine for our people, not on the policy, because already the policy is there. What we need to discuss is how best our people can get proper medication. Our people can get proper referrals where people have no interest. Because the reality is we are undergoing a lot of problems in terms of getting referrals and treatment for our people. I even got to an extent of thinking that we were not right to have really taken health to the county governments. Because county governments looks like they are not ready. And the county governments are not even taking care of our people down there, other than then strengthening the health facilities that are existing as referrals. They are now promoting their own. And by so doing, our people are getting more confused. So to me, I think the policy that is there is enough. On the other hand, I feel like the mover had good intentions because he was thinking about the problems that our people are undergoing. So I would urge him to go back to his amendment bill, see what is there, and then let us together relook at what is there. Because the capacity for the county governments is lacking. Always, it's soon collapsing. I don't know whether your constituencies are like mine. Soon the referral hospitals are collapsing. There is no medicine, congestion. You go to the wards, you just wonder what is happening there. So I think it is time we in this parliament relook again on what is happening at the referral hospitals. So for me, I'm not sure whether I support, I don't. Let us have this policy that is there, but let us look at it, see how best it can give services to our people. Thank you.
Woman McLeod.
Thank you, Mr. Speaker. I want to first and foremost congratulate my good friend, the servant of the people, Mheshimiwa Didmus Barasa, for coming out, identifying a gap within our hospitals. The fact that Barasa is able to identify what is wrong in our referral hospitals internally and externally is a very good idea. And it can only be enriched by us members and experts to make it even much better. So his idea for amendment of Article, the Health Act, number 79, is actually correct. But the question is it adequate to address the myriad challenges that are facing our referral system? Mr. Speaker, what is it that we refer? A doctor refers a patient when his training or professional competencies are not adequate to handle that particular matter. Capacity and competence, the competence, the training that you have to actually handle that particular matter is not adequate. So you refer to the next person or professional that has that particular knowledge to handle that particular matter even much better to rescue the patient. You can also refer when the equipment that you in possession in that hospital are not actually sufficient or good enough to handle the matter. Mr. Speaker, what is happening in our county governments, what is happening in the health sector, notwithstanding the comments by their chairman, is that when devolution devolved to health, when the constitution devolved to health to county governments, big names were given to our hospitals. You hear every district health center call a referral, and the big hospital in the county is called level 5, level 4. So, Speaker, truly to these hospitals' merit or what they do able to qualify for that particular position called level 5, level 4? The answer is a big no. The answer is a big no. We have big names called level 4, level 5, which are not actually supposed to be, which they don't have the capacity to actually handle the cases that are referred in level 5 or level 4. Mr. Speaker, what is happening today, even in our hospitals, our referral hospitals, is every Tom, Dick, and Harry goes to a referral hospital, even without a letter of referral. And I understand, Mr. Speaker, because when it comes to matters of life, you rush to the nearest place that will save your life. But, Mr. Speaker, there is need, as Barasa envisaged in this amendment, there is need to put the health sector in order. And the people to put the health sector in order are members of parliament. Because the pain that patients undergo on the ground is so huge. So, Speaker, you go to a level 5 hospital, and the doctor refers you to a clinic that does not have a level to go and buy medicine. What the honorable member for Nyeri said, there is a cartel. So, Speaker, the cartel, the mafia that is talking about, that was devolved from Avia House Mafia, are now in the counties called CMTs or county management teams. That is another cartel in our county governments. What happens there is, so Speaker, the CMTs micromanage the doctors until they lose morale. And the doctors do business. So, how does this thing happen? A doctor who has a private hospital organizes with those who are in government facilities that when you get a patient that has a very good insurance cover, refer that patient to my hospital so that I get something, and you get your commission. So you realize doctors compete to refer to various private hospitals so that at the end of the day, he goes to collect the commissions. And maybe even those hospitals are actually their own hospital. I have in mind a doctor who owns a hospital here in Kenya, a very serious hospital. And then when that doctor became sick, he did not go for admission in his own hospital, he went abroad. So now, what does it mean? That you don't have confidence, even what you own yourself, and the people that are doing that particular job. So, Mr. Speaker, I call upon Honorable Titmas Baraza to actually, this is the time to actually sort out the health sector through law, amending the act. In fact, Mr. Speaker, I encourage my brother Titmas Baraza to even bring an amendment to bring back the health workers to the national government. The nurses, the clinical officers, the doctors, let them be referred to national government, just like the teachers. That's like the teachers' unions were clever enough to retain TSC and management of teachers at national level so that they get a better conditions of service. Our doctors today are so demoralized in the county governments to an extent that they are not able to optimally operate in the government hospitals. Mr. Speaker, there is also a problem of external referrals. Today, there is a lot of technology. There is what is called telemedicine. You can be able to, that kind of consultation or expertise can be done in Kenyatta Hospital here and a hospital in India or America. And you can be able to get services there. So, Barasa, there is also, and all of us honorable members, that why don't we have also these investors of hospitals in India and China and Japan and Germany and London invest in Kenya through direct investment so that we go to the hospitals locally. We're able to get what is called Philippines doctors. These doctors that were brought some time and they are here in this country. Why, as a government, as a ministry, or the president have set land for investors? I was from America and I met Kenyan doctors who are saying, keep us land, we put up a referral hospital in our counties, a private hospital. So we can also do what is called direct investment by ensuring that doctors from India, Germany, Japan, actually invest in this country in medicine, in their hospital, so that instead of us referring to those countries, let them be here in Kenya so that they are able to give us that service that we would have flown all the way to those foreign countries. Mr. Speaker, there is need at the moment to put in order this particular sector. For example, Mr. Speaker, and I want to enrich my brother's amendment, people suffering from serious diseases, chronic diseases, lifestyle diseases, like diabetes, cancer. Why don't we have tax exemption for them so that the little that they have to invest in actually securing Medicare for themselves? These are things that we can do in our country so that we have some order, and the citizens of Kenya, the poor people on the ground, will need to get the best Medicare in Kenya. Mr. Speaker, many people are suffering in rural areas. Because many county governments invested in dispensaries and health centers without providing medicine, without providing personnel. It is time the ministry order county governments and governors to stop further building of dispensaries and hospitals without equipping the first ones, without ensuring that there is personnel in the first ones, to ensure that there are experienced and qualified people on the ground so that we reduce the number of referral cases that are going to our referral hospitals like MTRH, Kenyatta Hospital, and other referral hospitals in our county government, in the headquarters of the county governments. This is the only way we can, actually, this is the only house that can put order in the health care so that we stop the cartels, we stop the corruption.
Member for Kamukunji.
Thank you, Mr. Speaker, for the opportunity to contribute to this particular bill. I would like to say that I oppose it on the following grounds, because we have a total failure of successive governments in Kenya to provide health services to the Kenyan public. And as a result of that, our health services are not adequate, they're not affordable, and they're not of the quality that is required to deal with the challenges of health that we have in our country. Kenyans daily struggle with the poor medical services and facilities, exorbitant medical charges and costs. And that is the problem that is sending thousands of Kenyans to their early deaths. And I think that is the crisis that we have. And this particular amendment is just an indictment of the terrible health conditions and medical healthcare medical situation in our country. And this is a well-meaning amendment from our honorable member, Didymus Baraza. but it is a problem that you cannot sort by legislation. A knee-jerk reaction to a deeper ailment that is afflicting our health services, a deeper malaise that is paralyzing our health services. And I think to a certain extent, some of the things that he suggests here could be done by the Ministry of Health. Create regulations, for example, policy regulations for internal referrals. They can do that without a legislation. We can't legislate everything. But I'm surprised that he includes external referrals. And I wonder under what legislation, under what international agreement that we as a government can do to regulate referrals outside our country. I have already said that, in fact, the first problem is inadequate healthcare infrastructure. That is what we should emphasize as legislators, to provide more money so that more Kenyans can have access to basic health facilities, hospitals, clinics, and medical facilities. Insufficient funding. We need to increase our funding. And also, we also need to address the shortage of health workers, doctors, nurses, midwives. According to the World Health Organization, Kenya only provides half, or even less than half, of the required medical personnel and medical practitioners in our health service nationally. That's another issue that this House can address by providing more funding. I will also say that by passing this amendment, we're going to create a new layer of bureaucracy, another layer of corruption, which would create a cumbersome process which would slow down and cripple the normal work of medical practitioners, which then can lead to delays, bottlenecks that can make life even more difficult for the patient and their families. The bureaucracy that we are trying to put into place by making this amendment will put lives at risk and lead to the unnecessary death of many patients. And therefore, I think we should reconsider, because this particular amendment is trying to address an issue that requires a much more stronger intervention in improving our health services, in putting more money into our health services, but creating another bureaucratic layer is only going to make it more difficult in a situation of life and death. When you're taking a patient to hospital, a dear one, a loved person, you want he or her to get the best treatment that they can get. And because the public health facilities cannot cope with it, this is why we have a lot of private practices in this country. And to a certain extent in Kenya, because of misguided policies, almost all the good health services have been privatized. Ordinary poor people, rural people, the urban poor, cannot access health facilities. They cannot afford the cost of private medicine. And I think maybe this amendment discussion here in the House also provides us with an opportunity to rethink what kind of health services we want. Even the most advanced countries in the world have public health services that are affordable, in fact free in some situations. The British National Health Service, all the European unions have a heavily subsidized public services of good quality. And we're in a developing country with a large number of very poor people. And if we cannot improve and finance and improve our health services, then many, many poor people are likely to die of diseases that can be prevented or cured. And that's why I think this amendment should jolt our minds to make sure that, in fact, we go and look at alternative ways other than regulating. You know, some of the problems that are raised by it can be cured through internal mechanism. You know, our Kenyan medical services have professionals. They have professional institutions. The practices at the universities, medical practices at the universities and medical centers can incorporate stronger ethical practices that can overcome some of the problems that we create. We have realized in bringing this particular amendment to this House. So I think, to a certain extent, this amendment is trying to overcome many of our national problems, and I think that is just purely firefighting. It cannot resolve the bigger problem, the mindset, the culture, and everything related to it. But the bottom line is that in Kenya, our infrastructure is not good enough, our medical services are not good enough, our health services are not financed enough. We have serious shortage of professionals, and many of our good professionals, because of poor wages, are opting to go outside the country. You see, our nurses have been recruited in foreign countries, our doctors are going to foreign countries. What we need is to give them good terms of references and good salaries so that they can stay in this country and provide the services that are required. Therefore, Mr. Speaker, I do oppose this amendment and support the decision of the Health Committee. Thank you.
The member for Naivasha.
Mr. Speaker, thank you very much for this time. Because this amendment, when we listened initially to the experts or the committee chair, it was not clear whether we were discussing whether the bill is admissible into the House or the content of the amendment. Mr. Speaker, I believe every member of this House who comes up with a bill, and especially health, means well for this country. Health sector in this country is wanting. Mr. Speaker, health being devolved also, we have a problem in giving it the attention it needs financially. We all know at some stage, if you don't have, especially members of parliament, if you don't have a message asking you to pay a bill or some death notification through a disease, Harambes is what we do. Mr. Speaker, we have not addressed the budget of health sector, and more so even to county government. So there are so many things that need to be done, and I'm sure this is what the mover of this amendment was trying to address. Sometimes it's just communication. I know I have had communication done properly from Naivasha Hospital to Kijabi. The doctor in charge would call Kijabi and tell them I'm referring this patient there. So by the time that patient gets there, there's a bed, there's a facility, because referrals are done because of incapacity, not maybe of the doctors, but maybe the equipment, the expertise that is required on a patient. The most unfortunate thing, because I just checked with Honorable Barasa, is that the Health Committee chairman comes to the floor to reject the amendment, yet they did not call the mover to the committee. I think we need to be responsible. If a member moves a motion or a bill on health or on any other department, please let that committee call that member so that they can iron it out together. Where is the member coming from? What is it that we have? Because it really confuses this House. I've had 3 doctors communicating, they belong to that committee, rejecting this movement, this amendment, yet we know they would be the best person to advise the mover on how it should be put.
Honorable Jen Kihara, The statement you make that the mover of this bill wasn't called before the committee, is it a factual position? Have you checked with the mover?
I said I just checked with him, unless he didn't tell me the correct position, Mr. Speaker.
Because it can't happen. But proceed with your contribution.
I don't know where he is because I checked. Because this is serious.
The Honorable Didmas Barasa. Is it true you didn't get a chance to appear before the Committee of Health on this particular bill? Just put it in somewhere.
Yes,
okay, go ahead.
Yes, Honorable Speaker, it's very true that I never appeared before the Health Committee. They never invited me, Mr. Speaker. It's true.
Because the position is not whether you appeared or not. The issues, were you invited to appear before the committee? Did you get any invitation?
I did not get any invitation to appear before the said committee.
Okay, that's well noted. Go.
Thank you, Mr. Speaker. Yes, I had cleared with him because I thought this is an important amendment that should have been discussed properly with the mover. Mr. Speaker, we know this is a country of brokers at all levels. May it be land, may it be health, may it be what. So for purposes of protecting those people we represent, we need to have a good flow in medication center, referral, everywhere. Mr. Speaker, I know we have overturned a committee report in this House. So my proposal would be to let the committee of the whole House deal with the bill. Remember here we had a committee report that rejected the appointment of a CS. And when it came to the House, we overturned. Can we leave this report to the committee of the whole House when most of us understand, when we are more, so that it is debated properly? Mr. Speaker, health is very important. We have doctors moving out of this country, a lot of brain drain because of budgetary implications, because it looks like we have never as a country given it the necessary attention in matters funding. Thank you, Mr. Speaker.
The Honorable Member for Kigumo.
Thank you, Mr. Speaker. I'll rise to oppose the amendment to the bill. And I think from where we sit, we know that health is a critical area in this country. And while it was devolved with very good intentions, a lot of what has happened is that we've had a lot of problems in our hospitals. The amendment seeks to introduce another desk of bureaucracy, and that might not go well, because you know in our constitution the right to life is guaranteed in the Bill of Rights. And as a human being, when you have a problem and you think that it can be handled in another jurisdiction, I think that should be an area that should be left to the individual person to decide. while we might agree that controlling or having reference systems of the referral system in the country is ideal, we also know how underfunded and how poor we are in stocking medicine, in having the right expertise in our hospitals and dispensaries. I come from an area where we have a lot of chronic illnesses, that is being diabetes and high blood pressure. And while a lot goes into trying to control the same, we've realized that sometimes the capacity in that hospital is not enough, and therefore the people who are suffering should be at liberty to decide whether they need to be in that dispensary or they need to go elsewhere where they can get better attention. We do know while our training of our nurses is top-notch, because every time they go abroad, we know the countries are picking them up. We have a lot of brain drain. We have not been very good in managing the capacity that we have of our human resource. And so I would think that referrals should follow facilities, such that if we are able to equip our health facilities with good enough facilities, which include the doctors, nurses, and equipment, then we can start creating laws that decide that if you are not able to be treated in a certain facility, then you can be referred to another facility. But while we are still struggling with all manner of issues in our hospitals, creating a bureaucracy to stop people from seeking further attention elsewhere is just making a problem that is there worse. So my point is, I think we should leave, especially the outside the country, people should be left to decide where they want to be treated. If they are capable, and if they think that they are not able to get the facilities, the attention they need in this country, they should be able to decide and go without having to refer to anyone, without having to create a desk where we know that we might be introducing further place for people to rent sick. Finally, Honorable Speaker, I've heard that the member has not been consulted, and I know I've sat in committees here. Anytime we are looking at an issue that that's been raised by a member, we normally invite them and they present and they try and explain and justify where they are coming from. So I think it's a bit unfair that Honorable Didmas Baraza was not invited by the Health Committee to give his views or to explain, and it's an issue that I think needs to be looked at by the Honorable Speaker. So I stand to oppose the amendment and wish Honorable Didmas Baraza well as he continues to explore this area of health. Thank you, Honorable Speaker.
Thank you. Member for Makueni.
Makueni.
Member for Makueni is in the house.
Honorable Makueni, ama Honorable.
I called out for the member for Makueni, who I think it's you.
Thank you, Mr. Speaker, for giving me this opportunity to contribute to this worthwhile motion brought by Honorable Dismas. And my first concern and question is the fact that anytime we are making a law, I think the basic question we ask ourselves is, what problem are we trying to solve by having this law or this bill in place? And is the problem we are trying to solve the real problem affecting our people in this particular country? Basically, as other people have actually, as other honorable members have actually contributed, we realize that the problem we have in this particular country has nothing to do with adding additional referrals, but it's a situation where our referral systems and our health systems are not working right from the health worker. Because if you look at the basic level of the health worker, where the health worker is supposed to educate the citizens so that they can even avoid situations where we are getting sick because of ineffective diet or mismanagement of our diet, you realize that is even wanting, because our health workers, as we stand today, are volunteers, and volunteers whom we have not even checked their knowledge levels. So right from the community level, we have a system that is not even working to the expected levels. So I think, in my opinion, Mr. Speaker, to think of adding another layer of bureaucracy to a referral system that is not delivering all the services we expect for this country is not only retrogressive, but I think is a way of punishing our citizens for a system that actually is not working. I think the biggest problem that we have in our health system, which most of the honorable members have actually commented on, is the issue of inadequate capacity, right from the health worker to the topmost referral hospital in this particular country. And I think it would add a lot of value, Mr. Speaker, if we spend a lot of energy on correcting what is not working, as opposed to having an additional policy that actually limits those few of us who have coins to take their people away for treatment. I think we should even be apologetic that as members of this House who make decisions on behalf of our countrymen, we have a health system which we have actually continued to promote for years that cannot deliver the basic services that our Constitution guarantees to our own people. So, Mr. Speaker, I really oppose this bill and support what the committee has said, because if we look at this particular proposal, the kind of bottlenecks it wishes to put on those who want to access medical care elsewhere, I think it will actually make it will add injury to the already very injured sector in this particular country. So I think I oppose this particular bill, and I think probably we should have a bill that is actually trying to fill the gaps that all of us seem to be very aware of and seem to understand. Mr. Speaker, I've heard many of our honorable members talk of the bureaucracy in the system. You realize the health system as a kind of referral that is, although many seems to say it's a lack of capacity, to me I see it as lack of commitment. Because if you look at the issues that a nurse can address at the health center, you realize that nurse will refer, not because the nurse does not have the competence to handle the issues, but serious lack of commitment. So I think, in my opinion, Mr. Speaker, I think instead of thinking of additional policies that will hinder people assessing health, we need to have a bill that will enable us reflect more on how can we strengthen this particular referral system. If it is I don't think the major issue is where you put it, whether in the county government or the national government. I think the major problem we have is when you devolve functions and you don't devolve resources adequately. When we look at the growing population in this particular country, we realize that the demand for health is very high, but when you look at the resources allocated to health, right from the health worker level, you realize that the resources are very inadequate. Then when you had the issue of commitment and ethics, which seem to be seriously lacking, Mr. Speaker, sir, you realize that we have in big problem, and I think this House, I would wish to encourage honorable members, we get a bill that tries to cure this problem. Because the more we sit on this House and we don't address burning issues of health, I think it's not fair to our people. And especially so when even the national health scheme is also failing. I think this is an area that needs a lot of surgery, and I think it needs quite a lot of reflection. So with those few remarks, Mr. Speaker, I oppose this amendment with all regards. Thank you.
The member for Kisumu East.
Thank you, Speaker, sir. Speaker, I'm a little concerned. The objective of this particular bill was to introduce a new section for the development, and I concentrate, of policy guidelines.
And the Honorable Shakil, you have only 2 minutes on this.
Okay, sir. That'll be enough. For guidelines to regulate the referral of patients to health institutions. It is guidelines, and it is a section that will set out and put into writing some sort of proposal and procedure that the health authorities, the people in the health sector will want to comply with, so that they can refer. At this moment in time, the referral process is hodgepodge. It is a mess. People are being referred who don't need to be referred. We have problems here in our health service. We have not enough level 6 hospitals. The 1 or 2 level 6 hospitals that we have people referred for an ordinary cold. So I think this, those who are opposing this bill may not have understood that this is a policy. It's not a new, it's a bill to develop a policy. And Mr. Speaker, sir, in the health sector and others, bureaucracy is a very important hurdle. Not important, it's a very big hurdle. And if you leave them to make up their own guidelines and regulations, it will never happen. The other thing, Mr. Speaker, sir, is I have also an amendment with the Health Committee that we want level 6 hospitals. A level in each county, we have like now the Jaramogi Odinga Referral Hospital level 5. I've been a chair of that hospital for 11, 12 years. We never made, we paid all our bills. We did everything in time. There's a proposal that I have sent to the committee that is to take this to level 6. So level 6 hospitals can now be under the national, either like Kenyatta National Hospital or Moi National Hospital, to be out of the county bureaucracy and out of the county mafia. And I say this with great concern. I was the chair of the New Nyanta, or the Jaramogi, and we did very well. But unfortunately, at this moment in time, we have people who are sitting in a CEC Health, etc., who have come up with mafias. We cannot even have drugs. We do not pay. So I think there are certain levels of hospital, like referral hospitals, level 6. Let them now, the proposal I had is the issue of decentralizing health at all levels to county was probably not the wisest thing to do. We want the level 6 hospitals to come back. So, Mr. Speaker, sir, I strongly support this bill, and I feel that those who have opposed it perhaps did not understand or did not wish to look at this thing very carefully. It is the development of policy guidelines to regulate referral of patients to health institutions.
Thank you so much. Honorable members, debate on this bill is done. The time allocated for it has just lapsed. I've acceded to the member who moved the bill's request to reply the next time this bill is called out, and therefore the more will reply to this bill next time the bill is listed in the order paper. Next order.
Order number 13, motion, development of a policy and funding for junior secondary schools.
Thank you. Thank you, Mr. Speaker.
Honorable Speaker, I beg to move the motion pursuant to Section 48 of the Standing Orders, that aware that the communities have continuously established running institutions within their localities to address the inadequate physical facilities to support the attainment of universal access to education, and noting that the Kenya Vision 2030 envision progressive establishment of more schools, expansion and rehabilitation of existing ones in order to improve access to education. Further noting that huge sums of funds, particularly under the National Government Constituency Development Fund, have been invested in improving infrastructure in primary schools, acknowledging that in the recently introduced competence-based curriculum education system, pupils will transit to grade 6 to grade 7 and not class 8 as it was the case under 844 system. Concerned that the arrangement would compel students to travel for long distances to access institutions where junior secondary schools are based. Further concerned that the guidelines recently issued by the government directed that junior secondary schools be domiciled in the existing primary schools, yet most primary schools lack capacity to accommodate and effectively offer junior secondary schools curriculum. Deeply concerned that the guidelines were hardly developed and operationalized, this House resolves that the Ministry of Education to 1, urgently develop a comprehensive junior secondary school policy in order to regularize and anchor the guidelines under the Basic Act 2012 to ensure that junior secondary schools are established and operated in every primary school. 2, develop a clear implementation framework for the competence-based curriculum and junior secondary school level, and provide for a funding plan for a successful implementation of the curriculum. Honorable Speaker, education is a very vital, is a vehicle for economic and social change. It's therefore important that any curriculum be constantly reviewed to keep abreast on the globalization of the labor market, Mr. Speaker, and of course the demands for acquisition of the 21st century skills. Mr. Speaker, many countries have shifted from knowledge-based curricula to competence-based teaching learning approaches. In Kenya specifically, the 844 system, Mr. Speaker, was introduced in 1985. But over time, it became apparent that the system had several noticeable flaws, and one of the main problems with the system was it was very theoretical, Mr. Speaker, and with the emphasis on passing examination rather than developing practical skills. It is in this that the government of Kenya introduced a competence-based curriculum, CBC, under the 2633 system in 2017. Mr. Speaker, the CBC approach to the education aimed at providing students with practical skills and the knowledge that they can apply in real-world situations. It is designed to focus on developing competence of learners in a broad sense than just theoretical knowledge. The system also aims at equipping learners with skills, knowledge, attitude, and values that are relevant to 21st century, Mr. Speaker. The new competence-based curriculum specifically focuses on 7 fundamental competencies, namely, 1, communication and cooperation. 2, creativity and imagination. 3, critical thinking, Mr. Speaker, and problem solving. 4, digital literacy. 5, citizenship. 6, running to run. And 7, self-efficacy. Mr. Speaker, the start of 2023, this year, the school calendar in Kenya did mark a very important occasion with the first cohort of CBC runners to adopt the new curriculum in 2017, entering junior secondary school at grade 7. The implementation, however, has been met by a number of challenges, Mr. Speaker, and it is important we give a critical look into some of these challenges. One of the main challenges, Mr. Speaker, is inadequate infrastructure. And I am sure almost every member in this House do not have a laboratory for a junior secondary school in any of the junior secondary schools in our constituencies. I am sure, Mr. Speaker, at the same time, no member who has a workshop for junior secondary school in any of the primary schools in our constituencies. Therefore, inadequate infrastructure can affect the implementation of these very critical and important curriculum. The infrastructure plan by the government has not been addressed the big enrollment transition from grade 6 to a total of 1,287,597 candidates, having started the Kenya Primary School of Education assessment for the first time in 2022. All these students are expected to join junior secondary school, but they have been faced with insufficiency of classrooms, laboratories, stationaries, workshops, and library needed for the use of runners. This can limit the ability to run and experiment, which can affect their academic performance adversely, Mr. Speaker. Another challenge, Mr. Speaker, is inadequate teachers training. Inadequate teachers training. You realize that teachers we have in our primary schools today were trained to teach in the old curriculum. Most of them have not gone through the training, of course, conducted by the Ministry of Education in conjunction with the Teacher Service Commission, so that they can be able to handle this CBC curriculum at junior secondary level. The massive training and retraining of junior secondary school teachers is a major problem in the Ministry of Education and must thus be urgently dealt with, Mr. Speaker. The other challenge is the limited access to technology. One of the key requirements, or what this curriculum aims to achieve, Mr. Speaker, or the focus on these 7 fundamental competencies, one of them is digital literacy, Mr. Speaker. And you realize in my constituency, Better North, Mr. Speaker, there is not even primary school which has a laboratory with computers. So, and this cut across the Republic of Kenya. So many junior secondary schools in Kenya have limited access to technology, making it difficult, Mr. Speaker, for the student to be abreast with the latest education trends and development as required by the curriculum. Number 4, Mr. Speaker, is lack of parental and community involvement in implementation of this curriculum. Some of the parents, Mr. Speaker, are not actively involved in their children's education, which can negatively impact on their children's academic performance and overall education outcomes. Also, we have realized Another challenge, Mr. Speaker, is overburdening the parent. The curriculum at the moment requires a runner at grade 7 is supposed to take 12 compulsory subjects and 2 optional choices, summing up to 14 subjects. These are very heavy workload that can put us a huge amount of pressure on students, and it may be difficult for them to keep up with the demands of their studies. This may make the students struggle to balance the academic work and other activities such as extracurricular activities or even rest, and can also lead to burnout, exhaustion, and poor academic performance. Many subjects taught at junior secondary level may take it challenging for the teachers to provide in-depth instructions and personalized attention to each student. This can result in superficial understanding of topics, limiting student ability to apply knowledge in real-life situations. With these challenges, Mr. Speaker, we need to have a way forward for the junior secondary school so that we can provide this country and we can be sure that our kids, our children who are at junior secondary schools are getting the desired results from this education system. Honorable Speaker, for junior secondary education to effectively be implemented, there is a need to ensure that the following issues are entrenched in the implementation framework. One is curriculum development, which, of course, Kenya Institute of Curriculum Development should be highly involved teachers and other experts and other policy makers during the curriculum change and the process to create a positive attitude and energy among them for the smooth transition of the grade 6 pupils to junior secondary. This involvement process would help in ensuring that the curriculum developed is not only up to date but also in line with the national education objectives. The other important is the teachers, Mr. Speaker. The Teacher Service Commission should deploy and recruit and post teachers to junior secondary schools. And at the moment, we have a big challenge of the teachers in junior secondary schools, Mr. Speaker. These teachers in junior secondary schools will perform duties as per the Basic Education Act. Adequate and qualifying teachers should be recruited and trained to teach in junior secondary schools, and they should be fully prepared for the transition on how to handle the grade 6 pupils transiting to junior secondary schools in mind of this CBC curriculum. This training should focus on methodology, content, and assessment of the competence-based curriculum. Considering that the primary schools teachers are more familiar with the CBC than the newly recruited secondary school teachers who have no clue of CBC, TSC, or Teacher Service Commission, Mr. Speaker, should come up with a remuneration package for the primary school teachers teaching at junior secondary school by appreciating them with a token, even if it's a small one. This will stop the gap. This will be a stopgap measure to manage teachers' shortage in the initial years. This will also help to avert redundancy of primary school teachers due to the shifting of 2 classes to secondary schools. Mr. Speaker, the running resources is a big challenge and we need to take care of it. Running resources such as textbooks, laboratory equipment, and technology should be provided to enable effective delivery of the competence-based curriculum in junior secondary school. The Ministry of Education should develop a framework to facilitate sharing and management of infrastructure among primary school and secondary schools that will be established in the same compound. Monitoring and evaluation, Mr. Speaker, is another thing which should be properly anchored by the Ministry of Education to ensure the curriculum is properly implemented. And it should be across in each and every junior secondary school in the Republic of Kenya. The involvement of the community and parents, Mr. Speaker, is an important component for the acceptability. Teachers and parents can cooperate to encourage student participation in extracurricular activities such as sport, music, drama, and crafts. Regular parent-teacher conferences can provide an opportunity for teachers and parents to discuss a student academic progress, behavior, attendance, and other issues. Additionally, Mr. Speaker, parents and teachers can work together to promote health and wellness of students. This can involve encouraging health, eating habits, physical activity, and regular medical checkups. Regular parent-teacher conferences could provide an opportunity for parents and teachers to discuss the progress and challenges of their children. Parents can share any concerns they have with the teachers and work together to find solutions. They can also collaborate to promote positive behavior and social skills among students. Teachers can share information on the behavioral issues with the parents and work together to address them, while parents on their part should be also reinforce good behavior and values at home. Mr. Speaker, many schools in our constituencies, this is something which is not happening. Mr. Speaker, the policy is required to be created by the Ministry of Education. There are quite a number of factors which need to be considered by the Ministry of Education when coming up with a comprehensive junior secondary school policy. And some of these factors are, one, the legal framework. The curriculum reform should be undertaken within the national registration informed by Article 53 of the Constitution, which recognizes free and compulsory basic education as a right for every child in the Republic of Kenya. Article 43 of Economic and Social Rights states that every person has a right to education. The fourth schedule mandates the Ministry of Education to undertake education policy, standard and curriculum. To actualize this provision, Mr. Speaker, various legal documents have been deployed and ought to be followed according to the implementation of the junior secondary education. These include the Basic Education Act, Session Paper number 14 of 2012, Kenya Institute of Curriculum Development Act number 4 of 2013, and Kenya National Examination Council Act of 2012. In addition, the country provision for education should be guided by international pacts such as Sustainable Development Goals of 2015. The highlight of these policies include the provision of free and compulsory basic education that is reformed to inculcate interest and skills in science, technology, innovation, as well as environmental concerns for our vibrant economy. Number two, Mr. Speaker, which should also be considered by the Ministry of Education in coming up with a comprehensive junior secondary policy, school policy, is assessment and evaluation. A system of assessment and evaluation that is fair and transparent should be developed and implemented to monitor the progress of junior secondary schools runners. To develop more complete and fair runner evaluation process, there is need for focusing on both cognitive and non-cognitive attributes with fair balance between formative and summative assessment of runners. Other very important when considering this policy, Mr. Speaker, is funding. At the moment, the funding of junior secondary school in the Republic is wanting. Adequate funding should be provided by the government to ensure successful implementation of the policy. Many end teachers in our primary schools, especially in my constituency, Better North and Great Better North, we have a problem of funding. And there's no way, Mr. Speaker, we can be talking about CDF cannot be able to fund primary schools, but we fund secondary schools, tertiary colleges, and universities. And whereas the government policy is that we have a free primary education, but when you talk with the end teachers of primary schools, it's a serious problem of what is happening in our primary schools. So funding is one of great factor which need to be well focused by the Ministry of Education. Sustainability should be another factor. The policy should be designed to ensure sustainability by ensuring that there is a clear guidelines for the management and maintenance of junior secondary school. Governance, Mr. Speaker, governance policies should be adopted by the implementation of the curriculum. Reform where the Ministry of Education should strengthen streamlined governance structures to support implementation of the curriculum. It should also establish mechanisms for effective consultation, coordination, and evaluation of curriculum. You will find in most of the sub-counties in the Republic of Kenya, we only have one sub-county education director who is in charge of supervising or ensuring the governance of more than 100 primary schools in a constituency. There is need to increase the levels of governance within this school, junior secondary schools education curriculum. Access to curriculum support materials, public-private partnerships, inclusion of education, inclusion of equity in education. The government should promote inclusive education to ensure equity in education and training. This will help to address needs of runners with disabilities and vulnerable groups in nomadic and semi-arid areas, counties, and those living with extreme poverty and informal settlements. Mr. Speaker, in conclusion, it is worth noting that CPC implementation and specifically transitioning to junior secondary schools continue facing challenges with lack of adequate running facilities, lack of adequate training of teachers on CPC, ranch classes sizes, lack of adequate teachers, lack of adequate teaching running materials, ignorance, and lack of involvement by parents. There is thus need for the Ministry of Education, Mr. Speaker, to ensure that there is a junior secondary education policy well-grounded under the Basic Education Act of 2012 and implementation framework for sustainability. It is against this background, Mr. Speaker, I wish to seek the support of this House and this development matter of urgent national importance regarding development of policy and implementation framework for junior secondary schools in Kenya, as well as regarding the funding of junior secondary schools in the Republic of Kenya. Honorable Speaker, I beg to move, and I now request the Honorable Member for Kamukuji to second this motion. I thank you, Mr. Speaker.
Honorable Hassan of Kamukunji, we can't see your card. Okay, go ahead.
Thank you, Mr. Speaker. I stand to second this important and timely motion presented by Honorable Godfrey Ruku, the MP from Mbeere North. and I want to congratulate him for taking this important task. And I want to say that, in fact, the issue of the junior secondary school has not been brought to the attention of this House in the way it should have been, and I thank him for that. In all the constituencies of our nation, the 290, I'm sure that we're all grappling with the major challenges brought about by the rapid introduction of the junior secondary school system. This was a top-down policy driven, which involved elites, our top minds, education minds, but somehow did not trickle down as is required. And therefore, the introduction of the junior secondary schools has been a rapid thing, which has come with chaos and is crisis-ridden because of the points that have been adequately expressed by the motion mover: inadequate infrastructure, inadequate teacher training facilities, lack of parental and community involvement, and putting extra burden on already heavily burdened parents and communities. As a result, in my particular neighborhood of Kamkunji, we have over-congested classrooms with many students that had not been planned for, overloaded timetables, and overworked teachers, which, if it is not corrected with the proper framework and policy, could lead with the deterioration of the quality of education that we're providing to these youngsters. And I would have thought that, in fact, Mr. Speaker, when one is introducing such a major project like the CBC and the junior secondary schools, you would put into some planning, piloting, preparation, so that once it is launched, everybody is on board and it works very well. Unfortunately, in the case of the introduction of junior secondary schools, that has not happened, and it's not going very well, and that's why it is important to have a framework and a policy that guides the introduction and the future development of this particular process. So I think it is important to address these multiple challenges and to urgently introduce a framework and a holistic policy that can deal with all the challenges that have come about and can put the junior secondary school system into the right track and give our children the best opportunity for developing through this new curriculum. Therefore, Mr. Speaker, I second this important motion.
Honourable members, I now proceed to propose the motion for the development of a policy and funding for junior secondary schools by the Honourable Member for Mbeere North, Honourable Geoffrey Ruku, that are aware that communities have continuously established learning institutions within their localities to address the inadequate physical facilities to support the attainment of universal access to education, noting that the Kenya Vision 2030 envisioned progressive establishment of more schools, expansion and rehabilitation of existing ones in order to improve access to education. Further noting that huge sums of money, particularly under the NGCDF, have been invested in improving infrastructure in primary schools. Acknowledging that in the recently introduced competency-based curriculum, the CBC education system, pupils will transition from primary school at class 6 and not class 8, as was the case under the 844 system. Concerned that basing junior secondary schools in selected primary schools will render classroom facilities that previously housed classes 7 and 8 redundant, and that the arrangement would compel students to travel for long distances to access institutions where junior secondary schools are based. Further concerned that the guidelines recently issued by the government directed that the junior secondary schools be domiciled in the existing primary schools, yet most primary schools lack the capacity to accommodate and effectively offer junior secondary school curriculum. Deeply concerned that the guidelines were hurriedly developed and operationalized This House urges the Ministry of Education to, 1, urgently develop a comprehensive junior secondary schools policy in order to regularize and anchor the guidelines under the Basic Education Act 2012, and to ensure that junior secondary schools are established and operated in every primary school. And 2, develop a clear implementation framework for the competency-based curriculum at junior secondary school level and provide for a funding plan for successful implementation of the curriculum. Debate on this motion is now open, and the first person who will have the baton of the chair will be the Honorable Member for Bureti, Honorable Kibet Komingoi.
Thank you so much, Mr. Speaker. First, I want to congratulate the member from Barren North, Ruku, for bringing actually and thinking about our children in schools. We are aware about the change of this program and the introduction of the CPC program in our schools. Secondly, Mr. Chair, Mr. Speaker, we are also aware that this has been implemented, or the implementation has commenced. Noting from the report and the motion that is actually before us, there has been a trial run, what we would call the learning curve, on the things and the issues that now we are facing and our children are facing in schools. While this CBC program has been a hazard in itself, there are challenges that the country is facing, and especially the learners and the parents, including the teachers, on how this program has been brought about. And in support of this motion on the development of the policy, I wish to support Mr. Speaker on 3 grounds. 1, the access to the junior secondary school. During the interim period that has gone by, not all primary schools were designated as junior secondary schools. And therefore, this has denied some learners, or has created distance from the learners' homes to the new designated junior secondary schools. Without policy governing the distance between one school to the other, without policy governing the whole framework on the CBC, the continuation and implementation of this program as is going to affect our children. The second aspect, Mr. Speaker, is the question of the commercialization of our education sector. We will remember that the 844 system, one of the major setbacks of the 844 system was the commercial nature in which it was being implemented. The buying of books, the materials, the requirements in the school, and the many things that our children need for the purposes of implementing this system are also being taken into the CBC program and our junior secondary schools. We need to develop, together with the thinking that had been brought before about the school feeding program, the school uniform program that we had discussed previously, combining them together to see to it that we decommercialize our education system. But that does not mean that we remove the private sector involvement in our schools, because without policies, we will not be able to have a clear path through which we are going to set the school system in. Number 3 is the facilitation actually of the private sector to invest in the junior secondary schools. In the constituency I come from, Bureti constituency, there are so few centers that were approved for junior secondary school. And this is because of the policies that are not in place to guide in registration, identification, and the plans through which that we are going to put our institutions to check whether they can be able to provide the junior secondary school. It is my opinion, therefore, that with a proper policy and with proper framework being put in place, we will see other Kenyans being able to invest in junior secondary schools and be able to uptake some of the populations within our regions, and also to foster the economic growth within those areas in the education sector. Mr. Speaker, with that, I beg to support the motion and ask that the government quickly be able to move and provide direction, policy framework, and a guidance so that we may be able to streamline the education sector and to make sure that the provision of education is seamless from ECD, the primary schools, the junior secondary school, and the tertiary institutions. And further to that, Mr. Speaker, it should be remembered that these are children. We need to develop them. We need to create a seamless way in which you're going to invest, register the schools, and also to make sure that our children that we produce are people who are responsible and educated enough to know that this country can be developed by them. Thank you, Mr. Speaker.
Member for Kisumu East, you want to comment on this?
Mr. Speaker, thank you very much. Mr. Speaker, our education system is the bedrock of our future. In the 15 years I've been in Parliament, I have been shocked. Even as I was the mayor, I have been shocked at the way and callous way the education ministry has been looking at, those stakeholders have been looking at the future of our education. Honorable Speaker, sir, nearly 10 years ago, there was this was proposal that we were bringing laptops to our first standard 1 students. That in itself was ill thought of, knee-jerk, and it's been a dead duck it's been dead. A number of primary schools have got these computers. They're sitting in stores, and it is a mess. We've spent millions and billions of shillings on this. Ill thought of. CBC is a good idea. The junior secondary school is a bad idea. The issue is you cannot have a junior secondary school in a primary school. It was initially meant to be part and parcel of a secondary school. At this moment in time, Mr. Speaker, we have children in Standard 7 with different uniforms from Standard 8. Who are the more senior, Standard 8 or Standard 7? Then, Mr. Speaker, we have now secondary school teachers who have been posted to primary school to teach the standards, the junior secondary. Who do they report to? Do they report to the primary headmaster? Do they report to somebody else? What has happened by this knee-jerk experience? We were told in the last parliament, in the last government, would bring us 25,000 new classes and 25,000 laboratories in Kenya. Where are they? Then somebody got up and decided there's not going to be in the minister, the late minister, Professor Mogoha, and God rest his soul, a very good man, very committed, tried and went out of his way to build the junior secondary schools in secondary schools. Then I don't know what happened thereafter. It was now transferred to a primary school. Mr. Speaker, sir, even in your own school, you go to the school, the junior secondary have got a different uniform. They're actually Standard 7. They're being taught by secondary school teachers who have no idea of who they're reporting to. The whole curriculum is up in arms. So the whole situation and this proposal to put together and get some sort of order into the issue of the junior secondary school is a very good idea. But it stops short of making the corrective action that should be taken. The junior secondary should not, and I repeat, should not be in the primary schools. It must be in the secondary school, and that is what we must do. It is quite easy to move it back into the secondary school. We cannot have a primary school doubling up as a junior secondary school with a head teacher of a primary school who has no idea what secondary school teaching is. What about next year when there is Standard 9 or the second level of junior secondary? We have a big problem. Not a single laboratory in Kenya is there in the primary school. It doesn't make sense. We have done this, we have worked with CDF, and we've got laboratories in secondary schools. Many secondary schools and primary schools are next to each other. And I think it's about time the ministry realized they made a huge mistake. They've cost parents lots of money, going and having different uniforms, different this. Mr. Speaker, sir, in my constituency, many children are sent home because they have not got a uniform. Now, primary school teacher, headmaster is sending a junior secondary school boy back home. Where does the junior secondary school boy demand? Where is he? We have Form 1 who have come in. Where does this fellow fall in? He should be ideally going in and transiting into the secondary school system. So as much as we have the policies and as much as we agree that we need to sort out this thing, I think it is a big mess. The same mess that was created by the laptop program. Mr. Speaker, I am on record for informing the last government at the very highest level, and I was humiliated. And I was told that, I told them that in Rwanda and others, I was working on the 1 laptop per child program, and it is working very well. These guys felt that this is their own job. They humiliated us. The situation is right now, we are in a mess. I can't hear, sorry.
Motion next comes up. Honorable members, the time now being 1 p.m., this House stands adjourned until today, Wednesday, the 3rd of May, 2023, at 2:30 p.m.